A Surrey elementary school teacher who has COVID-19 has been admitted to the ICU now, and that has teachers in Surrey understandably worried as they prepare to return from spring break in a week. Considering the high COVID case numbers in schools in Surrey, will teachers in the Surrey School District be given vaccine priority compared to teachers in districts that have seen fewer COVID cases?
Yeah, so we are working through that with my colleagues. As we mentioned last week, we are prioritizing where we need to pay attention. And as we get more vaccine, we've heard we'll be getting more AstraZeneca vaccine, hopefully in the next week. We will be targeting the priority groups that we mentioned last, that are for the next phase. And absolutely, we're looking at a whole bunch of things around the communities where risk is highest. And Surrey is the highest in the province. Rupert was one of the high ones. We were able to do a whole of community approach. We're now looking at different communities around the province, but Surrey by far has been for some time in the highest risk area. So we are looking at several different strategies, including immunization of people in the education system, but also targeting businesses and some of the communities. So we're doing the work right now to see if we can understand better where the communities are most at risk, and making sure that if they're older people, they're into the age-based program, making sure we're bringing the immunization programs to the communities and that access is not an issue. So those are things that we've been working over this past weekend. We did quite a lot of looking at this. So yes, we will be strategically targeting communities where transmission is highest, and the flexibility of the AstraZeneca vaccine allows us to do that, whether it's a workplace, whether it's the school setting. And yes, we'll be prioritizing. As you know, we don't have enough vaccine to do everybody in the school system right now, so we will be prioritizing by where the risk is greatest.
You said earlier that you're seeing clusters related to some youth sports settings, and it's maybe not the kids so much, but the adults. Can you just expand on that a bit and what's happening in those types of settings?
Well, as you know, right now, youth sports are the technical, and we don't have games where people are moving around the province to play games. Although, if things go well, I'm hoping we will get back to that sometime near the end of April, hopefully. But we know that despite there not being spectators and parents not being involved, we know that there have been several instances, whether it's hockey, there's been some associated with basketball, other youth sports where there have been clusters and transmission chains in the community. So I don't want to call out any in particular, but I will say that it's happened on several occasions where it's led to tens or dozens of infections that then spill over into people's workplaces, into schools, and school exposures. So these are concerning. Right now, we're not seeing rapidly explosive outbreaks, with the exception of some work environments where it's really difficult for people to maintain the safety protocols that are in place. But we are seeing lots of small transmission events that lead to the next chains and next chains. That makes it very challenging to break those chains of transmission. And that's why we're saying, once again, we need to go back to doing things where it's safe, outside, keeping numbers small so that you're not risking that transmission that will lead to somebody else ending up in hospital.
Last week it was announced that certain frontline priority groups would be getting the AstraZeneca vaccine, and teachers appear to make up a large portion of those frontline workers. We've been told all along that transmission in schools has been low. So I'm just wondering, have teachers been contracting COVID in schools in greater numbers than we were first led to believe, or have teachers been passing the virus along to students in greater numbers than we first thought, or is there another scientific reason for prioritizing teachers in that group?
Yeah, no, we are not seeing transmission in greater numbers. We know that the safety plans in schools are working, and we see that in the low rates of transmission in the school setting. But the school setting is reflective of the community, and we do know when we have higher rates in the community, there's exposures that happen in schools, and we've been seeing that, and it's been particularly a concern in the Surrey school district. And when we see exposures in schools, it's very disruptive. It's disruptive because people have to self-isolate, people have to, the close contacts, and sometimes the whole cohort has to go to work from home or to have schooling from home. And that is disruptive to families, it's disruptive to the education of the children. So yes, teachers well, all of the educators in the school system are part of our priority group because of the role that they play in supporting the education system and how disruptive it is when we have exposure events given the high rates of transmission in our community. So it's very similar to why we are prioritizing police services, fire services, our emergency medical services, not because they're at high risk, but because they have an important function in society that can be disrupted, and disrupted quite severely if we start to get clusters and people have to be self-isolating. So it's part of reciprocity as well, making sure that we are able to support people who cannot work from home. And that's why it is also looking at some of the higher risk environments where we do see transmission and outbreaks. So it's a balancing of a number of different factors that has made that list. And as you know, that list is not exhaustive. And as more vaccine is available, we'll be looking at additional opportunities to immunize people to protect them in their workplaces as well.